When imaging the aortic valve, it's important to consider it as a complex comprised of the left ventricular outflow tract, the aortic valve cusps, and the aortic root. The aortic valve is a thinner structure than the mitral valve. Here you see a transesophageal short axis view of a healthy aortic valve with 3 cusps. This is a 3D echo image of a healthy aortic valve. You're seeing it en face as a surgeon would see it if they were operating. This is a 3D transesophageal echo of a replaced tissue aortic valve in the short axis. Remember that 3D echo also allows rotation of the image for a more detailed assessment. Here, with the echocardiography probe in one position, you can see the tissue aortic valve from both the aortic view and the left ventricular outflow tract view. There is a prolapse of the leaflet protruding into the left ventricular outflow tract. Aortic stenosis can also be assessed using 2D and 3D echo. A healthy aortic valve opens fully, while a stenotic aortic valve is narrowed and doesn't open fully. Direct planimetry can be used to measure the aortic valve orifice. Here, the crosshairs are indicating the left ventricular outflow tract. If there is a good view of the left ventricular outflow tract, you can use the continuity equation to calculate the valve orifice area. See the MedMastery Echo Masterclass, The Valves, to learn how to apply the continuity equation. You can quantify aortic stenosis in challenging cases by using X-plane mode. Most patients will have their aortic annulus measured on CT before they undergo a procedure on the aortic valve. Multiplanar reconstruction mode can be used live during a procedure to measure the aortic annulus dimensions for transcatheter aortic valve implantation, also known as TAVI. In patients with aortic regurgitation, 3D transesophageal echo can be used to assess the mechanism of valve dysfunction. In this 2D color compare transesophageal image, you can see there is severe aortic regurgitation. There is an abnormally bright structure that is prolapsing in and out and causing the aortic regurgitation. In the same case, using 3D X-plane mode, you see the aortic valve simultaneously in 2 orthogonal views. I can interrogate the entire aortic valve complex from the aortic root to the left ventricular outflow tract. There is prolapse of the aortic cusp into the left ventricular outflow tract, which is the cause of the aortic regurgitation. Congenital malformations are valve defects that patients are born with. Live 3D views of the aortic valve can be used to visualize congenital malformations, such as a unicuspid or bicuspid aortic valve. Here you can see 3D echo of a unicuspid aortic valve. Here you can see 3D echo of a bicuspid aortic valve. In summary, 3D echo allows for precise delineation of aortic valve anatomy and function.
So I hope you liked this video. Absolutely make sure to check out the course this video was taken from and to register for a free trial account which will give you access to selected chapters of the course. If you want to learn how MedMastery can help you become a great clinician, make sure to watch the About MedMastery video. So thanks for watching, and I hope to see you again soon.